glass. Okay, so type 1 glass is borosilicate glass. Type 1 glass is borosilicate glass and it is tested by powder test. Okay, type 2 is treated soda lime. Type 3 is regular soda lime. Type 4 is non-parenteral soda lime glass. Non-parenteral soda lime. So, this type 2, type 3, these are used for parenteral infusion bottles. Okay, storage of this infusion bottles. Like that we will use this type 1, type 2, type 3, and type 4 is non-parenteral soda lime glass. Okay, and type 2 glass treated soda lime is tested with water attack test. Okay, treated soda lime glass is tested with water attack test. So, here answer is A, type 1 is borosilicate glass. Next question. Blister packs are commonly used as unit dose packing for pharmaceuticals. Blister packing is, this is the blister packing. So, blister packing can be done for tablets, capsules and lozenges. So, the answer here is all. Next question. Which of the following one is a broken glass and acts as a fusion agent? It's not soda ash, limestone, culate. Okay. So, culate is the one which is called, which is a broken glass and it is used as a fusion agent. Okay, fusion agent, it is called, broken glass is called culate. Answer is C. Next, the eggshell skeleton consists of, choose a wrong answer. So, eggshell skeleton consists of the skull, okay, skull, spinal column and sternum or ribs. Okay. So, this includes, so all these comes under the eggshell skeleton except this upper and lower limbs. So, answer here is D. Next question. The largest bone in the human body, largest bone is thigh bone, femur, also called as femur. So, largest bone in the human body is transmitted to man by infected fleas. Okay. So, here plague is an infection. See, plague, this is transmitted by rats. Okay, plague is transmitted by rats. Here answer is the fleas are infected and it is transmitted to the human being by rats. So, answer here is C. The following are the arthropod-borne infections. Arthropod-borne infections means what? Infections that are transmitted by insects or arthropods, transmitted by insects. So, here in this case, except, so all are the, which of the following disease are not transmitted by insects? Here the question is. So, malaria is by mosquitoes. So, it is arthropod-borne infection. Plague is through rats, arthropod infection. Measles is a virus, viral infection. Filariasis is also mosquito. So, here answer is C, measles. Okay. So, that is not rest of the all other options are transmitted by any other arthropods. Next, incubation period of malaria. Incubation period is means what? From the point of infection to symptoms. So, that gap, so the time of infection to the arrival of symptoms. So, the time in between, that time period is called incubation period. That it is generally for 9 to 30 days. So, answer here is A. Ninth option is A. Next, the drug which causes skin pigmentation. So, here, so certain drugs are there. For example, methotrexate, anti-cancer drug, okay, anti-cancer drug, then amiodarone, anti-arrhythmic drug, rifampicin, it's an antibiotic, clofazimine, yeah, clofazimine and rifampicin. These are the drugs which causes coloration of body fluids. So, here this rifampicin anti-TB drug, antibiotic drug. Okay. So, here option is clofazimine and rifampicin, which causes the coloration of the body fluids like skin, sweat, all these are lightly dye colored, and even the methotrexate and amiodarone, all these drugs are responsible for skin pigmentation. So, mostly here the answer here will be skin pigmentation. So, it is clofazimine. Body fluids coloration is but rifampicin. Somewhat rifampicin is also responsible for coloration. Okay, skin coloration as of question directly, it is clofazimine. So, answer here is D. But in rifampicin is also responsible for coloration of body fluids. Next, dash is responsible for causing TB. Mycobacterium. So, it is Mycobacterium tuberculosis. So, answer here is bacteria. 11 is B. Next, following drug is mainly responsible for drug interaction through enzyme inhibition. Okay. So, the following is the drug which shows drug interaction through inhibiting an enzyme. So, here isoniazid is the drug which shows its action by inhibiting pyridine phosphate. Okay. So, this reduces the levels of GABA also. So, here this is also an inhibitor of CYP450 enzymes. So, drug interaction, the drug which is showing its action or which is showing drug interaction, okay, through enzyme inhibition, that is isoniazid. INH is the drug which inhibits this pyridine phosphate and also CYP450 enzymes. So, here the answer is A. In major surgery, which anesthetics are preferred? So, major surgeries, so here general anesthetics, local anesthetics, epidural anesthetics, none of this. So, local anesthetics and epidural anesthetics. Local anesthetics, this cause a numbness at particular area only. Like for epidural anesthetics, lower limbs, numbness in the lower limbs is caused. When major surgery is required, then you have to go for general anesthetics. So, answer here is 13A. Example of inhalational anesthetics: halothane, nitrous oxide, sevoflurane, ketamine. Here inhalational, that is gaseous. Okay, nitrous oxide. Okay, nitrous oxide is one which is given as inhalational anesthetic. Rest of the halothane, sevoflurane, ketamine are general anesthetics. Inhalational anesthetic is nitrous oxide. So, answer here is B. Which general anesthetic agent is used in asthmatic patients? Okay. So, halothane again, ketamine, propofol, fentanyl. So, here propofol is a drug which is used for asthma patients. Okay. Anesthetic which is used for asthma patients is propofol. Answer is C. An ideal antacid pharmaceutical composition has the following. So, antacid is means what which reduces the acidity in the stomach, which alkaline is the body inside the body, okay, which causes the alkalosis. So, it causes systemic alkalosis. So, this is the correct point. Ability to raise the pH, yes, we need to raise the lower pH, see from 3 to 4.5. Okay. So, the stomach pH is increased. That means it makes the pH of the stomach alkaline. So, it is causing systemic alkalosis. It does not maintain the desired pH for an adequate length of time. So, all are the characteristics. Yes, this is the character. It is saying here it does not maintain. So, this is not the thing. It should not cause constipation. So, all are the except C, all are ideal characteristics. Ideal characteristic, one of the ideal characteristics should be it should maintain the pH for a longer time. So, answer here is C. It does not maintain, it is given as it does not maintain, but it should maintain the desired pH for length or adequate required time. So, answer here is C. Next. The example of systemic absorbable antacids. So, antacids are divided into two types, absorbable, non-absorbable antacids, systemic antacid, non-systemic antacids. So, systemic antacids examples are sodium bicarbonate, and non-systemic or non-absorbable antacids are magnesium, aluminium, calcium containing compounds. So, if you see systemic or absorbable antacid, aluminium hydroxide no, non-systemic or non-absorbable, sodium bicarbonate, calcium, magnesium. So, here answer is sodium bicarbonate. 17 option is B. Next, sodium bicarbonate is used for sodium bicarbonate, NaHC. Sodium bicarbonate is used for, it is used for acid neutralizing properties, intestinal toxemia, dentifrice, no. So, here it is used as an acid used for neutralizing the acid, okay. So, answer here is, it is a, just now we have seen here sodium bicarbonate, it is a systemic absorbable antacid. So, it is, that means what it is, neutralizing the acids. So, answer is A. Next, match the following salicylic derivatives, anthranic acid derivatives. So, what is this? This is the classification of NSAIDs, non-steroidal anti-inflammatory drugs. Chemical classification of non-steroidal anti-inflammatory drugs. First is salicylic acid derivative. Example is aspirin. Salicylic acid derivative example is aspirin. Okay, this is the structure of aspirin. Okay. Aspirin. Next, N-aryl anthranic acid. So, here salicylic acid derivative A is 4. Next, aryl anthranic acid derivative. So, anthranic acid is there, it is mefenamic acid. B is 3. Heteroaryl acetic acid, If you see here, aryl acetic acid derivative, when hetero group is there, that is the only difference. So, indomethacin and ibuprofen. Okay, here if you see, indo group is hetero group. Okay, indomethacin means what? Indole group is there. So, indomethacin. So, hetero group is there. So, this is an example for heteroaryl acetic acid. Ibuprofen is an example for aryl acetic acid derivative. Now, C is 2. So, C is 1 and D is 2. So, here option is C. Acetaminophen is also called as paracetamol. Para position. So, you have substituents both at para position, and acetamide group, NHCOCH3 is the acetamide group. Ol, para position OH. This is the paracetamol. Okay, paracetamol, acetaminophen. Okay, that means para position, acetamide group, phenyl to the phenyl. Okay, this is the phenol group. And at para position, acetamide group is there, NHCOCH3. This is paracetamol or acetaminophen. Next, choose the correct statement about ibuprofen. It is a non-opioid analgesic which does not inhibit prostaglandin synthesis. It has analgesic but not anti-inflammatory efficacy. It has an analgesic with potent anti-inflammatory efficacy. It is available in high dose. Skip this question basket. Next, size reduction of the thermolabile substance is done by. So, thermolabile substances means what? Substances which are affected by heat, okay, which are sensitive to heat sensitive, okay, which are sensitive to heat. So, here in this case like cutter mill, hammer mill, colloidal mill we will not use. We will use fluid energy mill for thermolabile substances where high speed gas or jet streams at high speed, okay, gas or jet streams are passed, okay, in order to make collisions so that high heat is not generated, so that heat sensitive substances will not get affected. So, fluid energy mill is that one which will do that work. So, option here is D. Next, Dash mill works on the principle of impact between the rapidly moving balls. So, name itself is indicating between the balls the impact is being done. So, ball mill, hammer mill, colloidal mill, roller mill. Answer here is ball mill. Ball mill. Okay, 23 option is A. Fluid energy mill is not used for dash materials. Just now, a fluid energy mill is used for heat sensitive materials. It is not used for sticky or soft materials which will abrasive, friable, not soft sticky materials will make this process difficult. So, this is not fluid energy mill is not used for soft and sticky materials. Answer is C. Next, the largest artery is aorta, which supplies the oxygen rich blood from heart to rest of the body. Okay, so aorta is the largest artery which supplies blood to the rest of the body. So answer is B. 25 answer is B. Next, which of the following is a heart wall? So, endo means what, which is always a lining of internal organs or blood vessels or anything. So, endocardium is the lining. Wherever you see this vascular pericardium, continuous linings are there. So, the linings of the blood vessels is called endocardium. D. 3 is B. 3 is B. 3 is B, 3 is BS. This is the answer. Outer epicardium is the vascular pericardium, outer layer. Myocardium is a fibrous tissue, fibrous connective tissue which is surrounding this heart. Okay, which is the heart tissue. Okay, so myocardium. So 2 is C. So 1A, 2C, 3B. Answer is B. Next, which of the following artery supplies blood to diaphragm? Phrenic artery, not cardiac artery, to diaphragm, liver, stomach, to all these organs. Okay, the artery that supplies blood to the diaphragm, liver and stomach is phrenic artery. So 27 answer is C. Next question, the following all are standards for sieves used for pharmacopoeial testing except. So sieves standards means what the sieves have to do. Number of sieves, yes, that is one standard. Normal size of sieve hole, not particle. Okay, nominal diameter of the wire, nominal size of the aperture, that is nothing but the sieve hole. So here all are standards of sieves used for pharmacopoeial testing except the particle size. So answer here is B. See the next question, which one is called as fine powder? All particles pass through sieve number 10, 22, 44, 85. Okay. So, here 10 is for coarse, 22 is for moderately coarse, 44 is for moderately fine, 85 is for fine, 120 is for very fine. These are the sieves through which all particles will pass. So, this table you have to remember. Okay. So, all particles pass through sieve number 10, that is for coarse. Sieve number 22, that is for moderately coarse. Sieve number 44, that is moderately fine. 85 is fine and 120 is very fine. Okay. So, here through which there is also one part 40%, not more than 40%. The sieve through which not more than 40% particles will pass. For that also coarse that is 44, 60, 85 and not specified for fine and very fine. Not more than 40% pass sieve size, that is for coarse particles it is 44, for moderately coarse it is 60, for moderately fine it is 85. Where not more than 40% sieve size. So, all particles can pass through the sieve size. 10 is coarse, 22 is moderately coarse, 44 is moderately fine, 85 is fine, 120 is very fine. This you have to remember. So, there is a chance of getting question from this. Okay. Next, a screen that sharply separates the feed mixture is called ideal screen. Answer is D. Next, The following all are the uses of ammonium chloride. Ammonium chloride is used as an acidifier. Ammonium chloride is used as an acidifier. It is used as a diuretic and expectorant also. Miscellaneous category, diuretic and expectorant except a laxative. Okay, so it is not used as a laxative. Answer is D. Next question. The drugs which are able to neutralize alkaline body fluids. The drugs which are able to neutralize alkaline body fluids. So, neutralizing the alkalinity. So, acidifiers. Acidifiers are the drugs which are used to neutralize the alkaline. So, that is also neutralize body fluids, that is a systemic. Body fluids, that is systemic acidifier. Answer is C. Next, which of the following statement is correct for HCl? HCl hydrochloride is used as a catalyst in basic, it's used as a catalyst and colorless clear fuming liquid and acidifying agent. So, all are the correct statements about HCl. Answer is D. Digitalis is also known as Digitalis. Digitalis is foxglove leaves. Digitalis purpurea, Digitalis lanata. Okay, this another name is foxglove leaves. Withania somnifera. Withania somnifera is ashwagandha. Kumari means aloe. Okay, so here answer is B. 34 answer is B. Next, uses of Arjuna. Arjuna is a drug which is used for treatment of heart diseases. Okay, it is used as anti-arrhythmic, it is used to reduce cholesterol, it is used as a anti-hypertensive agent and it is also used as diuretic. So, here answer is C. 35 answer C. Next question. Digitalis belongs to the families Solanaceae. No, all the potatoes, tomatoes, all comes under Solanaceae. Umbelliferae, Combrettaceae, Scrofularaceae. Digitalis comes under Scrofularaceae family. Answer is D. Next question. Which analgesic drug inhibits the release of the substance P? Substance P is a neurotransmitter that is responsible for pain. So, inhibition of substance B, substance P causes pain relief. Inhibition of substance P causes pain relief. Therefore, here substance P is inhibited by the analgesic drug morphine, which inhibits the release of substance P and therefore morphine causes pain relief. So, answer here is C. 37 answer is C. Next question. Choose the correct statement about aspirin. Aspirin is non-dependent hepatotoxicity. Dose dependent hepatotoxicity. So, it higher dose. Therefore, Umbelliferae, Combrettaceae, Scrofularaceae. Digitalis comes under Scrofularaceae family. Answer is D. Next question. Which analgesic drug inhibits the release of the substance P? Substance P is a neurotransmitter that is responsible for pain. So, inhibition of substance B, substance P causes pain relief. Inhibition of substance P causes pain relief. Therefore, here substance P is inhibited by the analgesic drug morphine, which inhibits the release of substance P and therefore morphine causes pain relief. So, answer here is C. 37 answer is C. Next question. Choose the correct statement about aspirin. Aspirin is a non-steroidal anti-inflammatory drug used to reduce pain and fever. It is not opioid. Okay, it's not opioid analgesic. So, this statement is wrong. It inhibits the synthesis of prostaglandins. Yes, it is a reversible inhibition of COX enzyme, cyclooxygenase enzyme, but it is an irreversible irreversible inhibition. So this also is statement is wrong. The correct statements are A and C. Okay, it is a non-steroidal anti-inflammatory drug used for the reduction of pain and fever, and it is also inhibits the synthesis of prostaglandins. Paracetamol is contraindicated means, see, paracetamol, the most common side effect is dose dependent hepatotoxicity. Dose dependent hepatotoxicity. So it higher doses cannot be metabolized by the liver, and it causes hepatotoxicity. So it is contraindicated in bleeding disorder, fever, nephritis, chronic hepatitis. That means what? It is contraindicated in patients which are having chronic hepatitis. So here answer is 39, answer is D. Next question. Recommended dietary allowance of vitamin C in adults is 30 to 45 mg. It is grams, it is there. So this option here is C, 30 to 45 mg. Answer here is C. Next. Nyctalopia is a condition caused due to the lack of which vitamin? Nyctalopia means night blindness. Night blindness is caused due to the lack of or deficiency of vitamin D. Vitamin deficiency causes rickets, osteomalacia. So it is not correct. Vitamin A is causing nyctalopia and xerophthalmia. So answer here is A. Vitamin C is scurvy. So here nyctalopia is caused by the lack of deficiency of vitamin A. Vitamin A. Option is B. 41 option is B. Next question. The vitamin which is essential for the formation of red blood cells and antibodies in humans. It is RBC formation. Riboflavin is responsible for FMN and FAD cofactors through which the RBC is formed. So here answer is B. 42 answer is B. Next. Lobelia is also known as erica nut, no. Tobacco, tomatin, none of the above. Erica nut is not correct. Lobelia is tobacco. So 43 option is B. Which of the following drug is an example of do not originate from the amino acids? The drug which is not originate in its biosynthesis from amino acid. If you see here, ephedrine is obtained from the precursor is phenylalanine. So nicotine is from aspartate sometimes, okay, aspartate. Then caffeine is from xanthase. Then colchicine is also from tyrosine, phenylalanine, tyrosine. Okay, so here all these are amino acids except this xanthase. That's why answer here is C, caffeine. 44, the drug which is not obtained or originated from amino acid, that is C. Next question. Which alkaloids is used as anti-malarial? Alkaloidal drugs, cinchona alkaloids. Cinchona alkaloids are used as anti-malarial drugs. So morphine is an analgesic, so no. Cocaine is also no, analgesic. Ephedrine is a adrenergic drug. So this is also no. Quinine, yeah, cinchona alkaloids consists of quinine, quinidine. All these are cinchona alkaloids which are acting as anti-malarial drugs. So option here is D. Next question. Which section of the Pharmacy Act deals with the qualifications required for registration as a pharmacist? Section 8, 12, 25, 29. Here section 8 gives about the allowances, remuneration of staff. Staff allowances, staff remuneration, this is all of the Central Council staff, and remuneration of the Central Council staff members is done in section 8. Section 12 will give you about the regular courses and exams to be conducted, syllabus exams for registration as a pharmacist. Okay, for pharmacist registration, what are all the courses and examination required, that is being dealt in section 12. Okay, and in section 25, job term term and vacancies, resignation of the staff, and all these things are dealt under section 25. So then the qualifications for the pharmacist registration is dealt in section 29. So section 28 will give you about the central council staff, allowances, remunerations, all things. 12th is about the exams and courses to be registered as pharmacist. 25 is about the vacancies and the terms, job term, annual term, vacancy and resignations, that is of the staff in the 25, section 25. Section 29 deals with the qualifications that are required for registering as a pharmacist. So answer here is section 29D. 46. Next. The Drugs and Cosmetics Act regulates manufacture, sale and distribution of drugs. Yes. Import and export of poisons is through Poison Act 1919. So it is not. No. Pricing is from National Pricing Authority. Okay. So it is also pricing is not done. Over the counter drug sale. Okay. So here the manufacturing, sale and distribution of the drugs is being monitored by Drugs and Cosmetics Act 1940. So option here is A. Next question. Which statutory body is primarily responsible for enforcing the Drugs and Cosmetics Act 1940? Primary Council of Pharmacy Council of India, National Institute of Pharmaceutical Education, no. Pharmacy Council of India is primarily responsible for enforcing Drugs and Cosmetics Act. That is CDSCO, Central Drug Standard Control Organization, under the control of Ministry of Human Health and Welfare. So here the answer is C. The statutory body that is responsible for enforcing Drugs and Cosmetics Act is Central Drug Standard Control Organization, CDSCO. 48 option is C. Next. Packaging should help in packing of drugs. It should show labeling, that means information should be shown. It is also must be used for identification and presentation. So all of the above is the correct one. 49 option is D. Next question. Match the following type 1, type 2, type 3, type 4 glasses. Here type 1 glass, borosilicate glass, already we discussed. Type 2 is treated soda lime glass. So A is 2, A2. So A2, this 2. Next, type 2 is treated soda lime glass. Yes. Type 3 is regular, C1D3. Type 4 is general purpose soda lime glass. So option is 51 option is B. Next question. Which bone links the cranial and facial bone? Cranial and facial bone is linked by sphenoid bone. Okay, sphenoid bone. This is a butterfly shaped bone which links the cranial and facial bones. Next question. Which bone is roughly triangular in shape? Triangular in shape, nasal bone, inferior. Yeah. Nasal bone, inferior nasal cancae, lacrimal bone. Okay, actually the roughly triangular bone is scapula bone and sarcum bone. Okay, so the bone which connects this lower cervix, okay, that is roughly triangular in shape. Okay, so here the answer is D, none of the above. 53 is none of the above. Next question. Which bone forms the posterior portion of the hard palate? So name itself is there here, palate. Palatine bone forms the lower hardest portion of the palate. Okay, so palatine is the answer. Next question. The action of contraceptives. Contraceptives are the ones which prevents this ovulation, fertilization, implant. Okay, so prevention of ovulation and fertilization. Prevention of ovulation prevents rapid passing of eggs into the oviduct. Prevention of ovulation, implantation and fertilization. So here contraceptives will prevent the ovulation and fertilization. That step itself is prevented. So 55 answer is A. Next question. The action of cream and jelly. Cream and jellies in the contraceptives. Okay, contraceptive point of view, the action of creams and jellies is entangle sperm. No, it is used to stop the sperm. So spermicidal or immobilizing the sperms, and it is also spermicidal. Enables the sperm reach towards ovum, no. Prevents the ovum from being released, no. So option here is 56B, spermicidal and immobilizes the sperm so that it not reaches the egg. So 56 answer is B. Next question. Which of the following is unrelated to the objectives of the family planning program? Achieve population stabilization. Yes, that is the objective of family planning. Create awareness about sex-related aspects of society. Yes. Provide infrastructure and professional expertise. Yes. So, solve the problems of illiteracy and housing. No. Yes. Option here, 57 option is D, because all other are the objectives of this family planning program except this providing housing. So, option is D. Which of the following action is related to the thiazide diuretics? Okay, thiazide diuretics, common side effect is causing hyperuricemia or gout. Okay, so this is the option which is the responsible common side effect is hyperuricemia. Okay, next question. Two main objectives of PTC. What is PTC? Pharmacy and Therapeutics Committee. Pharmacy and Therapeutics Committee. So, the main aim of this committee is to make policies, okay, is to make policies regarding this medications, okay, education and policies, making policies and objectives regarding the medication. So, the objectives is to maintain order in stock, manufacturing, dispensing, advisory and education, both A and B. To minimum objectives is to make policies, advices to the medications and educating the about the medication. So, here 64 answer is C. Next, pharmacist is head, administrator, secretary. So, here PTC consists of a group of admin, managing staff, okay, and also includes pharmacist, physician, nurse, okay. So, here there is no such role. So, not a head, administrator, secretary, none of the above. 65 option is D. Next, the PTC comprises of a group of individuals who formulate concerning the therapeutic usage of the drugs, ethics, policies, rules, regulations. So, they will make policies. PTC makes the policies. So, 66 option is B. Next question. Which of the following is not an example of wax obtained from vegetable sources? So, wax obtained from vegetable source. Japan wax, beeswax, carnauba wax and CL wax. Beeswax, lanolin, tallow, animal fat. Okay, tallow is an animal fat. Beeswax, tallow, all these are examples for animal wax. So, here the option is rest of the plant, all the waxes are obtained from plant sources. This is obtained from animal source. So, 67 option is B. Next question. Starch is hydrolyzed by thiolin to maltose. Yes, starch hydrolysis. So, starch hydrolysis test is a test which tests the ability of the bacteria to hydrolyze the starch. That is a different thing. Here in this case, here starch is hydrolyzed by thiolin to maltose. Hydrolyzes sucrose to lactose. No. So, here A is correct and R is wrong. Okay. Sucrase, actually this sucrase is an enzyme which hydrolyzes sucrose to lactose. That is not correct. Starch is hydrolyzed by thiolin, which is a alpha amylase enzyme. Okay. So, here A is correct, R is wrong. Option here is C. Next, at equal concentrations, which one of the following mucilage will possess maximum viscosity? Maize starch, rice starch, wheat starch, potato starch. So, maximum concentration of maximum amount of starch is present in, see here, wheat and grains rather than the potato, this is having the less amounts of starch. Here maximum amount is seen in potato starch. Here option here is 69D. Next question. Which one is not a method of streak plate technique? Streak plate, this is the technique which is used to separate the bacterial colonies. So here different types of, in this method, different types of introduction of the inoculum is there. Like see, this is a zigzag streak method, radiant streak method, continuous streak method, 4-quadrant is there, square is there, zigzag is there. Okay, direct transfer method is not there. Okay, except this, all other the methods of streak plate technique, where we can technique which is used to colonize the bacterial colonies, which used to separate the colony wise. So square method, 4-quadrant method, zigzag method, all these are there except direct transfer method. So option here is C. Next, acid fast staining method is used for the isolation of. So remember, acid fast staining, it is used for the tuberculi, Mycobacterium tuberculosis bacteria, because it is having thick fatty mycolipids. Okay, that's why it is not done through regular gram positive, gram negative fast staining. Okay, gram staining. So here we will use acid fast staining. So for Mycobacterium leprae, which acid fast staining is done by using certain chemical carbofuran. Okay, so here answer here is A, 71. Next question, carbofuran stain is used in which staining technique? That's what I said just now. Carbofuran is a stain which is used in acid fast staining. This acid fast staining is used to test this Mycobacterium tuberculi and leprae. Okay, so it is not gram staining. Acid fast staining, carbofuran is used. So here answer is B. Next question, which blood pressure reading is generally considered hypertensive? Hypertensive means high rise in the blood pressure. Okay, so 150 by 90, 120 by 80 or 90 is normal, 130 by 85. Hypertension is 150 by 95 mmHg. So 73 option is D. Next question, rheumatoid arthritis typically affects the larger joints such as knees and hips first, and it's more common in men than in women. So here rheumatoid arthritis is typically affecting the not knees and hips, it is wrist, elbow. Okay, the bones present on the wrist, elbow, feet. Okay, these are being affected, and it is more common in women, not men. It is more common in women than men. So here both statements are false. 74 option is B. A patient with a history of hypertension presents with a sudden onset of severe headache, vision changes, shortness of breath, which is the most likely explanation for this symptom. So already is having the history of hypertension, that means high BP. So rheumatoid arthritis flare up, severe headache, vision changes, shortness of breath. Hypertensive, migraine, anxiety attack and hypertensive crisis. So here option is here B. 75 option is B. Name itself is the all these are the severe hypertensive symptoms. Which schedule under the Drugs and Cosmetics Act deals with the standards of Ayurvedic, Siddha and Unani medicines? Schedule G, Schedule T, Schedule F, Schedule E. Okay, Schedule G will give you about the doctor prescription drugs, the drugs which require the doctor prescription, like hormones and anticonvulsant drugs. So it's not Schedule G. Schedule T will give you about the information of GMP of Ayush. So guidelines for the standards. Okay, the Schedule Drugs and Cosmetics deals with the standards for the Ayush, that is in Schedule T. Schedule E is for poisons. Okay, so here answer is B. 76 answer is B. Next, the Drugs and Cosmetics rules under the Act, which of the following facilities for running a pharmacy effectively? proper storage facilities are required, licensing is required, documentation and documentation of sales is required. So, option here is D, 77 option is D. Next question, which schedule is concerned with the requirements for the manufacturing of sterile products? Schedule P is life period of drugs. Schedule N is minimum equipment required. Minimum equipment required for running pharmacy. Schedule M is GMP practices for maintaining the factory, okay, facilities and equipments. So, Schedule Q is dyes, colors, dyes and all used in soaps and all. So, here the drugs and cosmetic are concerned requirements for the manufacture of sterile products, that is discussed in Schedule M. Schedule P is about life period and N is for minimum equipment required. Schedule M is the GMP practices for factory maintenance and sterile products maintenance, manufacturing, all the good manufacturing practices of all the products is under M. Schedule Q is about the dyes and cosmetics, colorants that are used in the soaps. So, answer here is C, 78 option is C. Next, the main objective of the Narcotic Drugs and Psychotropic Substances NDPS Act is to, it's all about the narcotics drugs. So, control of drug prices is no, drug pricing authority is done. Regulation of drug manufacturing, no. Illicit trafficking and abuse of narcotics, narcotic drugs and psychotropic substances. NDPS Act is controlling or prevention of illicit trafficking of this narcotics. So, licensing of arms is also no. Option here is C. Correct answer is C in 79. Next question. Under the NDPS Act, punishment for possession of the narcotic drugs in small quantities for personal use includes quantities irrespective, if not fine, it is imprisonment is very stringent in the Narcotics and Drugs Act, NDPS Act. So, imprisonment up to 1 year, fine or both, life imprisonment, confiscation of property. So, here option is B, where imprisonment and fine will be there. So, option here 80 option is B. Okay. So, this ends with this question, it ends the session. All the best.